Hi there, I'm Steve from Brisbane and I have haemophilia. I had no family history of haemophilia, was diagnosed just before my first birthday after a large bruise appeared on my left shoulder. I had been diagnosed with severe haemophilia. I subsequently grew up as an only child. I spent lots of time in hospital as a kid, often stayed overnight in the wards as a toddler. Later on, I would go with mum to the day ward for treatments, often 3 times per week. My childhood was pretty dislocated and I missed a lot of primary school. Mum learned to do IVs when I was around 8 years old. Home treatment was a big improvement for me and my school attendance improved. I still had 2 to 3 bleeds per week. In my late teens, I learned self-treatment, which born a newfound independence. I went on to prophylactic treatment in my early 20s. Unfortunately, most joint damage had already been done in my childhood given the frequency and severity of bleeds. Arthritis in my knees and ankles had become very painful. Some days I was not able to walk. In my 40s, I had major surgeries, these being bilateral knee joint replacements in 2012, left ankle fused in 2014, right elbow ulnar nerve transposition in 2015, and a right ankle fused in 2017. Getting vein access became more difficult with age and caused me much stress for some years. I had PICC lines done, which required weekly trips to the hospital to keep clean. Eventually, I needed to have a portacath inserted in around my right shoulder. Hospital had become my second home in some form or another for most of my life. Deciding to go on gene therapy was a big decision, and there were lots of aspects to consider, including, firstly, the potential for it to improve my life. I was excited by the thought of no more bleeds and no more IVs. How safe and effective would it be given it was a trial? That is, some uncertainty and no guarantees of a sustained response. It will be a long-term commitment, 5 years monitoring, particularly heavy the first year with regular visits to the hospital for tests to track my progress. And would I even pass the various medical assessments to qualify? I mainly spoke to my haematologist about what was involved, the likelihood of a good medical outcome, details of what exactly would be involved, as well as the potential known side effects, and if they arose, how would they be managed? I also undertook my own research to assist with evaluating the pros and cons. The possible impact of my work was a minor consideration. I have a good job with the government and I knew I could access flexi time and leave. I also knew I had a supportive workplace as I'd previously experienced my surgeries. I prioritised gene therapy given its potential benefits and so would organise my other activities around it. I have had no joint bleed since being on gene therapy. However, I have required treatments for several falls, 2 involving my dog, which resulted in bruising. While I still got swelling and stiffness, the bruising was not as extensive and severe as it used to get before. I also have had to have a couple of preventative doses before scheduled procedures, these being for a root canal and a colonoscopy. Since my late childhood, I had heard there would be a cure for haemophilia in the next few years. So to see gene therapy become reality when I was 50 was pretty surreal. I was fortunate to be asked to go on the trial and I made an informed choice in agreeing to do so. The result, over 5 years later, is that gene therapy has just been so life-changing for me. I am in a great window of my life right now. My health has significantly improved, as has my day-to-day lifestyle. My life is much more stable. Not to say it was all rosy. I did experience a bumpy side for a while shortly after the gene therapy infusion. I had significant elevation of ALT levels for my liver, so was prescribed steroids to bring them back down. Initially, I did not go too well on prednisone, given I struggled with its effect on my mood and my sleep. I was swapped over to tacrolimus, an immunosuppressive drug, but unfortunately it did not make much difference to my ALT results. I had to go back on high-dose regime of prednisone for some months, and this was a pretty intense time for me mentally. This coincided at the beginning of a global pandemic with COVID-19 and its emerging impacts, which had not been factored into the gene therapy trial. Given I had also become immunocompromised this was a testing time for me. Nothing's really changed for me significantly from a physical perspective. I am still pretty careful in feeling what I need, what I'm comfortable to do and not to do. However, I do feel freer mentally, and there is some relief around that for me. The impact of my immediate family was the same throughout, I guess. They've been incredibly supportive throughout my life, and they were just wonderful during my time on the gene therapy trial. They were especially compassionate when I was on steroids, knowing how hard things were going for me during that time. I had great support from my haematologist and all the Haemophilia Treatment Centre staff. I found their support very reassuring and felt they were always looking out for me and had my best interest at hand, especially when things went wobbly with my ALT results. A challenging issue for me, though, was how to deal with disclosing to friends and work colleagues I was on the trial. I was going through this life-changing process, cautiously optimistic for a good result, but I was not clear about who to tell, and if I did tell them, how much detail should I go into? I discussed my conundrum with the haemophilia social worker at the time, and she suggested, who needs to know and who do I want to know? This provided me with clarity, and I used it as a guiding distinction. In the short term, treatment success is my life today. I've gone from being in a severe category at less than 1% normal clotting factor for around 50 years to now mild at around 10%. Truly amazing. I am not thinking much anymore about how to manage haemophilia in my life. Things like remembering when am I due for my next dose, hope I will be able to access my port first go, worrying about how much longer will my port last, when is my next appointment up at the hospital, and when is the next batch of product due for delivery. I no longer need regular treatments. I am not having breakthrough bleeds anymore. I am not having downtime waiting to recover from a bleed. I am not immobile for an extended period of time, missing work and social events. And thankfully, I experience way less pain now than ever before. Next month, I am travelling to Europe for 6 weeks, which will be my first trip there in 25 years. I will only be taking a couple of doses this time just in case I might need it, but it won't be a large esky full of product. This too will be liberating, but a bit strange at the same time. In the longer term, treatment success will obviously be a sustained response. My fingers are crossed. To be clear, I do not consider gene therapy to be a cure for haemophilia. For example, I still occasionally get painful arthritic episodes in my elbows. However, gene therapy has been positively life-changing for me. I feel blessed and I'm incredibly thankful to be chosen to go on a gene therapy trial.